Have you ever thought that the very pills you take every day, the ones meant to protect your health, could quietly become a silent killer? What's truly alarming is that most doctors will not tell you this directly. After age 60, our liver and kidneys no longer function the way they used to, yet we continue taking medications as if we were still in our 30s. And that is exactly when the risk of heart attack and stroke starts lurking day by day. I am not telling you to stop taking your medications. I simply want you to understand what you might really be facing. There are at least 7 common medications, both prescription and over-the-counter, that can significantly increase your risk of cardiovascular and brain-related events. Even more concerning, you might be taking one of them every single day without even realizing it. In this video, you will uncover each of these medications one by one, especially number 1, which has been the hidden trigger behind many sudden heart attacks in older adults. So stay with us until the end of the video, because what you are about to learn could be the key to living longer, staying healthier, and truly enjoying your golden years without the constant fear of stroke or heart attack. NSAIDs, Advil, Aleve, Celebrex. The first drug on this list is also the one most often underestimated: NSAIDs, or non-steroidal anti-inflammatory drugs. The name may sound unfamiliar, but chances are you encounter them every day under familiar labels like Advil, Aleve, Motrin, or by prescription as Celebrex. These pills help relieve back pain, joint aches, or headaches, allowing you to walk, garden, play golf, or simply get out of bed without your knees screaming in pain. For those over 60, the ability to move without pain can feel like a small miracle. But behind that convenience lies a serious risk that many people overlook. When you take NSAIDs regularly, especially after age 60, your body starts to retain salt and water. The result is rising blood pressure. And you might not even know it, even if you're already taking medication to manage it. Picture your blood vessels like the plumbing system in your house. If you pump in more water but the pipes don't expand, the pressure inside increases. That's exactly what's happening in your body when you use NSAIDs long-term. But it doesn't stop there. These drugs also make your platelets, the cells responsible for clotting, more likely to stick together. In simple terms, they increase your risk of developing blood clots. And even one small clot, if it travels to your brain or heart, can trigger a stroke or a sudden heart attack. What's most alarming is that many people develop a kind of mild dependency on NSAIDs, taking them daily without informing their doctor, assuming over-the-counter means completely safe. The risks become even more serious as you age. Your blood vessels lose elasticity. Your heart has been working tirelessly for decades, and now it must contend with elevated blood pressure, clot risk, and reduced blood flow, all at once, just because of a painkiller that seemed harmless. You take it to relieve pain, but if you're not careful, it could silently lead to a tragic outcome. NSAIDs aren't the enemy, but if you've been using them daily, especially for weeks or months, it's time for a serious conversation with your doctor. After 60, no medication is truly light. Every drug decision deserves much more caution and care than before. Diabetes medication, TZDs, pioglitazone. The second drug on our list is familiar to anyone managing type 2 diabetes, the thiazolidinedione group, commonly known as TZDs. The most well-known among them is pioglitazone. If you're taking this medication, your doctor probably told you that it helps your body use insulin more effectively. This helps keep your blood sugar under control and lowers the risk of complications in the eyes, kidneys, or nerves. It all sounds promising. But once you pass age 60, things become more complicated. One of the most common side effects of TZDs is fluid retention. For younger individuals, this may not be a serious concern, but for older adults, especially those with a history of heart disease or high blood pressure, fluid retention is one of the main reasons the heart becomes overloaded. Imagine your heart as an engine that has been running non-stop for over 60 years. It still works, still tries to pump blood every day, but now it has to work harder to move the extra fluid caused by the medication. Over time, the heart gets tired. Blood doesn't circulate as efficiently, and that's when heart failure quietly begins to set in. You might not notice it immediately, but your body will send signals. Feeling short of breath on a slow walk, swollen ankles at the end of the day, constant fatigue even after a full night's sleep. Many people assume these are just signs of aging or diabetes symptoms, but few realize the real culprit might be the very medication they're relying on to manage their condition. Not everyone who takes TZDs will face this risk, but if you're over 60 and using pioglitazone, it's essential to monitor your heart health closely. Don't hesitate to ask your doctor if there's a safer alternative that fits your age and cardiovascular condition. Because the goal isn't just to control blood sugar, it's to protect your heart from silent strain. Prescription sleep medications. The third drug on this list addresses a familiar issue for many people over 60, insomnia. When you lie awake at night, tossing and turning, unable to fall asleep, it is natural to want a quick fix. And so, prescription sleeping pills become the lifesaver that seems safe. At first, they feel like magic. You take a pill, close your eyes, and within minutes you are asleep. You wake up feeling a bit more rested, your mind less tense. But behind that comforting feeling lies a series of risks that not everyone is warned about. Numerous large-scale studies have shown that using sleep medication regularly, especially in older adults, can significantly increase the risk of death from various causes, including stroke and heart attack. Why? The first reason is that these drugs slow down your breathing during sleep. In some cases, you may even stop breathing for a few seconds, a condition known as sleep apnea. For younger people, the body can usually correct this. But in older adults who are already taking heart medications, blood pressure drugs, or NSAIDs, this can become extremely dangerous. Just one missed breath can lead to sudden oxygen deprivation, which may trigger irregular heartbeat and increase the risk of sudden death during sleep. The second danger is nighttime falls. When you wake up in the middle of the night to use the bathroom, the medication may still be active. Your mind is foggy, your balance unsteady. A single misstep can result in a broken hip. And for the elderly, a fracture is not just an injury, it is the beginning of a serious chain of complications. Reduced mobility, blood clots, infections, pneumonia, and even death within months. Additionally, sleep medications can impair memory and concentration. Long-term use may lead to forgetfulness and confusion, especially if you are also taking tranquilizers or antidepressants. The sad truth is that the pill you trusted for rest and recovery may actually be bringing you closer to danger. If you are taking sleep aids every night, take a moment to talk with your doctor. Are there safer options? Are there other therapies that can help you sleep without risking your life? Because sleep should be restorative, not a gamble. And after age 60, no habit is too small if it affects your heart and brain. Older antidepressants, tricyclic antidepressants. The fourth drug group on this list may not be as commonly prescribed as before, but it is still written into millions of prescriptions for older adults each year. This is the group known as tricyclic antidepressants, with names like amitriptyline and nortriptyline. You may have seen these in your prescriptions, not just for depression, but also for nerve pain, sleep issues, or chronic anxiety. If you are taking one of these medications, the first thing to remember is that depression is not a sign of weakness. It is a legitimate medical condition, just like high blood pressure or diabetes, and you absolutely deserve proper treatment. The issue, however, is that not all medications are equally safe after age 60. Tricyclic antidepressants work by adjusting the levels of serotonin and norepinephrine in the brain, chemicals that affect mood. However, these medications also influence the heart's electrical system. Simply put, your heart works like a clock powered by electrical signals. Every beat is triggered by a signal that must arrive at the right time and in the right direction. These drugs can slow down, confuse, or disrupt those signals, leading to a condition called arrhythmia. In younger people with strong hearts, mild arrhythmias are usually harmless. But for older adults, especially those with a history of high blood pressure, mild heart attacks, or hardened arteries, just one bad signal can result in sudden cardiac arrest. What is even more concerning is that there may be no warning, no pain, no obvious fatigue, as arrhythmias can strike without notice. You are simply trying to find peace of mind, but the pill that calms your mind might be throwing your heart into disarray. That does not mean you have to stop taking your medication, but it does mean you should talk to your doctor about safer alternatives. Today, there are newer classes of antidepressants like SSRIs that are generally safer for heart health, and especially for those over 60. Because healing the mind should not come at the cost of your physical health. You deserve both a calm mind and a strong heart. Decongestants. The fifth medication on this list may sound harmless because you typically take it when you have a cold, allergies, or nasal congestion from weather changes. These are decongestants, with familiar names like Sudafed, Dayquil, NyQuil, Mucinex D, or any product containing pseudoephedrine or phenylephrine. You feel congested, short of breath, your head heavy. Then just one pill clears your nose and clears your mind. It feels like relief. But behind that relief is a potentially dangerous biological response, especially for people over 60. These medications work by constricting blood vessels in the nose, reducing swelling and opening the airways. The problem is, they do not only constrict vessels in the nose, they affect blood vessels throughout the body, including those near the heart and brain. This can cause a sudden spike in blood pressure, sometimes to dangerous levels, particularly in people with a history of hypertension, heart disease, or stroke. Think of your circulatory system like a network of pipes. If you tighten the pipes but keep the same volume of water flowing, the pressure inside will shoot up. That is what happens in your blood vessels when you use a decongestant. In older adults, blood vessels are no longer as flexible, and the heart has been working tirelessly for decades. When pressure rises too quickly, the heart can easily become overwhelmed, leading to a sudden heart attack or stroke. Another risk that often goes unnoticed is that many over-the-counter cold and allergy medications are sold as combination products. A single pill might contain fever reducers, cough suppressants, antihistamines, and a decongestant. But the label might not clearly state this. You think you are just taking cold medicine, but you might be consuming a powerful vasoconstrictor without realizing it. You just want to breathe easier for a few hours, but it is not worth the risk of a life-threatening event. If you are treating high blood pressure or heart disease, speak with your doctor or pharmacist before taking any cold remedy. Sometimes a seemingly simple pill could be the last straw for an aging heart. PPIs, proton pump inhibitors. The sixth drug on this list is among the most commonly used medications in the U.S., especially in older adults. These are proton pump inhibitors, or PPIs, with familiar names like Prilosec, Nexium, and Prevacid. If you have ever suffered from acid reflux, heartburn, or nighttime stomach pain, you have likely taken one of these. And to be fair, PPIs are very effective. They reduce stomach acid quickly, provide relief, help you sleep better, and let you eat without worry. Many people feel like they have a protective shield for their stomachs when eating spicy or greasy foods. But the problem begins when these medications are used for months or even years. Without realizing, they may be silently affecting your heart, kidneys, and nutrient absorption. To understand this, you need to know about a critical substance that keeps your blood vessels healthy: nitric oxide. It helps blood vessels dilate when needed, reduces inflammation, and prevents plaque buildup. But recent research shows that long-term use of PPIs can reduce your body's production of nitric oxide. When this happens, blood vessels become stiffer, less flexible, more inflamed, and more prone to damage. This creates the perfect environment for plaque to accumulate, narrowing arteries and increasing the risk of blood clots. And it only takes one small clot in the heart or brain to trigger a heart attack or sudden stroke, even without warning symptoms. Additionally, long-term PPI use is linked to reduced absorption of calcium and magnesium, increasing the risk of osteoporosis and falls. Some studies also warn of a connection between PPIs and chronic kidney disease when not properly monitored. The troubling part is that many people take PPIs as a kind of stomach insurance, one pill a day without a second thought. But no one tells them that the longer they take it, the greater the risks, not just for the stomach, but also for the heart, bones, and kidneys. If you are taking PPIs daily, especially if you are over 60, it is time to reassess. You may only need them for a few weeks, or your doctor might suggest a safer alternative. Remember, you are taking these pills to protect your stomach. Do not let them quietly weaken your heart, kidneys, and bones in return. Calcium channel blockers, amlodipine, diltiazem. And finally, the seventh and most paradoxical type of medication is calcium channel blockers. You may already be familiar with names like amlodipine, diltiazem, and verapamil from your daily prescriptions. Indeed, these drugs are prescribed to protect the heart, lower blood pressure, and prevent angina. So, why are they on a list of medications that can cause the very thing they are trying to prevent, a heart attack? The reason lies in a small detail that many people overlook: the difference between fast-acting and long-acting drugs. Some fast-acting calcium channel blockers can cause blood pressure to drop too quickly and too suddenly. When this happens, your body doesn't feel relaxed. Instead, it goes into a state of alert. The autonomic nervous system responds by releasing adrenaline, which makes your heart beat faster and harder to compensate for the falling blood pressure. For a healthy heart, this might not be an issue, but for people over 60 whose blood vessels are already hardened by atherosclerosis, blood flow to the heart is already not easy. This increased heart rate then causes the heart muscle to demand more oxygen, while the blood supply is insufficient to meet that demand. The result? Myocardial ischemia, chest pain, or even an immediate heart attack can occur. What's more dangerous is that symptoms like fatigue, dizziness, and shortness of breath are easily mistaken for the normal side effects of a blood pressure medication. You might think the drug is working, but in reality, your heart is struggling to adapt to the sudden change. This is why today, most medical guidelines in the US recommend that older adults use slow-release calcium channel blockers. This type of medication is designed to dissolve slowly in the body, maintaining its effect for 24 hours, which helps lower blood pressure gently, steadily, and more safely. The problem is that not everyone has this difference clearly explained to them by their doctor or pharmacist. Within the same drug group, a small change in formulation can lead to a significant outcome. Therefore, if you are taking a calcium channel blocker, check with your doctor or pharmacist. Ask, is this the slow-release form? That simple question could be the deciding factor between effective prevention and an unexpected health risk. 7 types of medications. 7 subtle mechanisms that affect your heart and blood vessels. Not because the drugs are wrong, but because a body after the age of 60 no longer responds the way it used to. Fluid retention, increased blood pressure, changes in heart rate, making blood more prone to clotting, and reduced recovery during sleep. All these things can accumulate over time and lead to a health event you never saw coming. But the good news is, you're not helpless. When you understand how a drug works in your body, you can ask your doctor the right questions, you can adjust the dose, choose a safer formulation, or change your habits to reduce your reliance on medication. Because health after 60 isn't a matter of luck. It's the result of your daily decisions, from the pills you take to the questions you dare to ask in the doctor's office. If this video has helped you better understand the link between medications and cardiovascular risk, please hit the subscribe button on the Senior Health Guide channel now. We will continue to bring you reliable, scientific information to help you live proactively, live healthily, and stop worrying about strokes or heart attacks. Wishing you a peaceful, healthy day and a truly fulfilling old age.